And I need to share my screen, don't I? All right, folks, as y'all are coming in, I'm last minute getting my technical things going.
Welcome, everyone. Very excited for today's episode, as always.
All right, we'll let folks give everybody just a couple minutes to get settled. Get your lunch out, grab a water, grab a soda or a pop, if you call it a pop, whatever you need. And sit back, enjoy the wonderful conversation that we are going to have today, focusing on sustainability and health. So we'll get started here in just another minute. Let everybody get in and then we'll get on our way.
It is a beautiful November day.
I was just thinking the same thing, looking outside the sunshine. It's unusually warm. And then I don't know if folks have seen the very cold drop that's going to be happening on Saturday. Very disappointed in those temperatures, but I guess we've been kind of living the dream here with this very warm weather for November. So
living the dream or a climate nightmare. Which is it?
Which is it? Great way to start our episode today. All right, well, we've got a good few folks of you coming in. So we'll of course, more folks will probably be joining us here, but we'll go ahead and in the interest of time, go ahead and get started. So of course, everyone, welcome to the show and to Sustainable in the City. With today's episode, we are very excited to have John Vick here, the Interim Director of the Office of Primary Prevention with the Tennessee Department of Health. And he is here to talk to us about how the sustainability of our neighborhoods and how our community and how that can impact our health. So we're really excited to bring this episode to you all today. It's a topic we've been very interested in bringing to the show. So excited to have that talk. As always, Sustainable in the City is a partnership between Zero Waste Nashville, that's me, Jen, and Urban Green Lab, that's Christina over there. So we are your two hosts today to share this with you and partner with this to share all things about waste and sustainability here in Nashville. And I'm going to turn it over to her to talk a little bit about our chat feature and our Q&A feature.
Yeah, thanks, Jen, and hello, everyone. Welcome. Always so appreciative of the folks who take their lunch break with us. So just a quick reminder of how we communicate on this show. We use the chat set to everyone to share your thoughts, your comments, maybe your tips, your curiosities in the chat, and so that you can kind of chat with each other. But we are using the Q&A feature for the actual questions that we are going to ask John at the end of the episode. So if you want your question to be answered, we are asking you to put that in the Q&A function, and we will make sure that that is answered at the end of the episode. If your question is in the chat, there's a chance that we will not get to it, so please put it in the Q&A. We'll try to remind you in the chat as well as we go through. But that chat is really there for you all to talk to each other as attendees and share anything that you'd like to share as it is relevant. So we appreciate you using the Q&A for the questions themselves. We're going to skip our normal question right now because John has a fun question for you all to use in the chat. And just want to remind you that every episode is recorded and put on YouTube. So please don't forget to just subscribe to Urban Green Lab's YouTube channel. And also we will be adding this episode, as with all of our episodes, up on that channel so you can watch it and share with folks. We appreciate that. And just a reminder, if you haven't seen our email that went out recently, for December, we're doing something a little different for our episode. We want to hear from you. We want to hear what lingering questions you still have as we're going into the new year, things that you really want to hear a little bit more about, something that we didn't talk about that maybe we can give a quick answer to. If there was anything that you want to share as a story, or maybe a fumble that you had with sustainability and you'd like to share it and show how you kind of overcame that, we want to hear from you. So please email us at zerowaste@nashville.gov, and we will kind of parse through those and put together a nice, fun, celebratory episode for the end of the year and really get through some of the questions that you still have as an audience. So I think that was all we wanted to share, Jen, and we are ready to get this episode rolling. It's going to be a great one, and thank you again for joining us.
Yeah, really excited. I will note, I've seen some of those emails coming in already. We've gotten some really great questions. So if you haven't sent your questions, haven't sent your stories, I'd love to share some fun, exciting stories from all of y'all's sustainability journeys. So just going to keep pushing that out there, but let's get into our conversation today because it is going to be great. So let me go ahead and pull up my little questionnaire here. But first and foremost, I would like to introduce John Vick to our show today. And I'm going to let him start us off actually with the question he wanted to ask everybody. Well, let me ask the first question. I'll let you roll it all in together. I think maybe that makes sense. So maybe share that question that you have, but then also tell us a little bit about yourself. Who are you? Who is John? And what has been your journey into getting into the position that you're at now and your role?
Sure. Well, just first of all, I want to say thank you so much for inviting me to be a part of this series. It's always exciting when people invite public health to be a part of important conversations. Public health and sustainability are, certainly intertwined, interconnected, and so really pleased to be here to talk about that connection. So before I talk about myself, I am going to give you an opportunity to practice with the chat. I'm going to ask a question, so please answer the question in the chat, not to be confused with the Q&A. So in the chat, I would like for everyone to tell me, doesn't have to be long, just a few words. If you had to pick 3 things that you think are elements of a healthy, sustainable community, what are those 3 things? What are the 3 most foundational things to a thriving, healthy community? So as people are putting their answers in the chat, I'll tell you a little bit about myself and how I got here. So I work in public health now. I have not always been here. I actually started off, my bachelor's was in psychology, and I really had an interest in working with people and helping people. And my first job out of college was doing policy research at Vanderbilt. And I got really interested in the idea of helping people not just through connecting one-on-one, but really helping people through changing systems and changing policies. And so that really became my professional goal, is to think about how do we change our policies, our systems, our environments, so that we can help people thrive and be healthy in our mental and our physical health, our environmental health. So that's been my professional goal. I went to grad school at Vandy. I focused my grad school work on urban planning, policy, and community development. So really focused on the built environment, but on the social side of that. So thinking about how do we empower communities to participate in decision-making around shaping their environments and their neighborhoods, and how can we better do that? Worked as a researcher in academia for a while. And then I came into public health a little bit later. One of the things I noticed when I was doing a lot of community engagement and urban planning work is that health was increasingly becoming part of the conversation. This was something that people were starting to see coming out in the research. People were really acknowledging that, the spaces and places around us impact our health. And so, we really need to be thinking about how the decisions we're making impact people's health as we're making them. And so I ended up working in public health almost by accident. It turns out that the Metro Public Health Department here in Nashville was looking for someone who could really focus on that and think about that built environment and health connection. So I actually worked in Nashville in Metro government at the health department as an epidemiologist, but I did a lot of work around health equity, built environment, and the social drivers of health, all those social and environmental factors that impact our health. And you're going to hear me talk a lot about those, and you're probably putting some of these things in the chat right now, but we're really, when we're talking about built environment and health, we're talking about things like safe, stable, and affordable housing. We're talking about having different options for mobility, for transportation, like walking and biking and transit. We're talking about access to parks and green space and having tree canopy. We're talking about land use planning. What are the policies that shape what our neighborhoods look like? And a lot of different things that we can talk about. There's a lot of research now that shows how important all these things are to public health. And so, that's really guiding our work at the state, which is where I am now. So I landed here at the state about 5 years ago. I work in the Office of Primary Prevention. I started off as the Evaluation and Assessment Director for that office, and I'm now doing both that and serving as the Interim Director for our office. I'll tell you a little bit about the mission of our office and what we do. So our mission in the Office of Primary Prevention is to help Tennessee communities build a culture of health through livable and nurturing places and spaces so that everyone can reach their full potential. In public health, we're really thinking not just about the absence of disease. We're not really just talking about healthcare. Healthcare is important, is necessary, but it's not sufficient for good health. So we're really trying to think about how do we create communities that are healthy to begin with, where you can really make those healthy choices. And that's the easy default choice for people to make. And so we're trying to think about ways to do that. And that's what our office is charged with. So we're thinking a lot about social drivers of health. We're thinking about built environment. We're thinking about health equity. Where do we need to focus our efforts the most? So those are our goals, some of the things that we're thinking about and working on in our office of the Department of Health. And I think we're gonna get into some more detail with that as the questions come in. But I'm gonna take a quick look at the chat now and see what everyone is saying. So let's see. So I see access to healthy foods, green space, education. What else? Public transit, clean air and water, trees and open spaces. A lot of the things that I just mentioned are showing up here in the chat. Walkability, clean water, democracy, love that. Wildlife, education, community engagement. Yeah, so lots of things that we're thinking about and working on at the state level. And so I think, when we talk about communities and like what's healthy and what allows people to thrive, I think a lot of us think about the same things. I think there's sort of a set of foundational things that really make communities great places to live and be healthy. So, those are the things that we're thinking about.
So I think you jumped in, you covered my second question as well. So we're going to jump on to our third one and just kind of dive right in. So how does the sustainability of a community or neighborhood really directly impact human health in both the near term as well as the long term? What does that look like?
Yeah, it's a great question. And, I think sustainability is tricky, just the word. And I know that's the title of this series, and so I think everybody here probably knows it, but that's a really tough term to define. And I think if I had asked everybody to define that in the chat, we'd probably get a lot of different answers. So I think sustainability can mean different things to different people. But I think, when I think about sustainability, I do think about those sort of foundational things, the things that you absolutely need in order to thrive. And if you don't have those things in a community, it's really tough to be healthy. So, in public health, we're thinking about, what are the ways that we can encourage those things to happen? So, for example, if you live in a community that does not have sidewalks, you really are pretty limited in how you can get around in that community. I mean, even if you want to walk, even if you have that desire, if the sidewalks aren't there, it's going to be really tough to do that. And some people are going to do it anyway. But what we want to think about is, why are we not putting these things in place so that that's easy for people to do? Same with bikeways, same with parks and green space, all of those things. We want to make sure that those foundational elements are there so that people can be outdoors, they can be physically active, they can be safe. So I think if we don't have those things in place, we're really not living in communities that are sustainable.
Yeah, Christina and I, just before we hopped on the call today, we're actually just talking about, and as you mentioned, sidewalks. An example I was thinking about was just the other day, I saw a runner that was running along a sidewalk, and then there was something impeding the sidewalk, so they couldn't use that safe space to run anymore. They had to get off the sidewalk into the middle of a really busy street to continue on their journey of what they were doing. So one, they were trying to avoid one thing on the sidewalk that they could have tripped, they could have hurt themselves in that aspect, but then they are also putting themselves in other danger, because then now you're in the middle of a busy roadway.
Yeah,
I'm
yeah.
I'm glad you brought up sidewalks. We were talking about it earlier, and just how little things about them really impact health in many ways. So our next question is, are there some specific examples of sustainability issues in particular that you directly work on to improve the health of Nashville neighborhoods?
Nashville neighborhoods. Yeah. So I'll give an example of a project. So I will mention too a little bit about how the health departments are structured in Tennessee. So here at the state, we operate health departments in all of the rural and suburban counties, but the big metros, the cities like Nashville, Knoxville, Memphis, Chattanooga, they actually have their own city health departments and staff their own city health departments. And so although we do work with them and we fund them to do certain things, it means that we at the state level tend to do a little bit less in the cities because they've got their own staff and a lot of resources to put into public health in those spaces. So we tend to focus a lot on rural and suburban communities and the work that we do. And so because of that, we don't do as much in Nashville. That being said, we do have some things that we're doing. So one thing that I will mention, we have a grant program in our office. This is one of I think the most impactful things that we do out of the Office of Primary Prevention. We have a grant program called Healthy Built Environments. This grant program has been up and running for 5 years. It looks a little different now than it used to. This is a competitive program where local government or state government entities or nonprofits can apply to us for funding to plan or build something that's health promoting. So we funded things like sidewalk and bikeways plans. We've funded downtown master plans, greenway and parks plans. We've funded walking tracks at schools. We've funded greenways, improvements to parks, bike shares, all sorts of different things across the state. One of, I think, the most interesting grants that we have right now is in Nashville. So Walk Bike Nashville, which is a fantastic nonprofit in Nashville, if you're not familiar with them, applied for one of our grants and was awarded a grant to do a bike ped safety study on Dickerson Pike. So if you know Nashville and you know Dickerson Pike, you know that it's one of the most dangerous corridors in the city. Some of the highest crash and fatality rates of anywhere in Nashville. So they applied for a grant to do a bike ped safety study and do a temporary design installation called tactical urbanism, where you come in and you do something temporary to show what's possible, to show how it might look to make this a safer place for people who are walking and biking. And a lot of people do walk in that area. And so they did an amazing job of bringing together a lot of different stakeholders in the community. So they brought together community members, people who live there, who work there, churches, schools. They brought in city departments and city officials, council people, and then also state agencies like TDOT, because Dickerson Pike is a state route. And they brought everyone together. They talked about the issues. They looked at the data. And then they partnered with another great nonprofit in Nashville, the Nashville Civic Design Center, to help do the tactical urbanism project. So they engaged some youth to help actually do the build out of this temporary installation. So what they did is they put in some barriers to help protect pedestrians. They sort of essentially painted the sidewalk bigger than it was in some bright colors and put in some new lighting to help at night. To do some things to make the distance shorter for crossing. They painted some crosswalks. They did a few things to just show how that could be a safer, more pedestrian-friendly place. And because they did that and involved TDOT, TDOT said, well, hey, you guys have shown what's possible. You've engaged the community. There's a lot of community support for this. So we're actually going to put in some funding and make this permanent and redesign this roadway to be more pedestrian friendly. And we're going to use a similar process as a way to do this in other places as well. So a really amazing example of where, even though in public health, we don't directly control decision-making around transportation, we don't have the transportation dollars. We don't get to decide how they're spent, but we do have some state funding that we can award at the local level. And this one happened to be in Nashville, where we can get something started. And then, the people who do make those transportation funding decisions can then take it and build off of that. So our little $80,000 grant has now generated an investment of, I think, about $30 million from TDOT to rebuild that section of Dickerson Pike. So, really exciting project. Love to see things like that include community engagement, active transportation, and in the end, it's gonna save lives. So, those are all things that contribute, I think, to community sustainability.
Well, that's we had an episode with the Civic Design Center actually a few months ago who had talked a little bit about that program, but I don't know that they had not mentioned kind of some of the outcomes. I think they were still waiting on that. So it's really for those of you that haven't seen that episode, go back and watch that one on the Civic Design Center. They talk about a whole bunch of other things that they do, but it's exciting to hear what has happened. I've been waiting I hadn't kept up with it to find out what was coming from that project, but such an incredible example of all these different community partners and how all these different groups come together, work together to make some really significant change here in our local community here in Nashville. So another kind of how you work with communities. What are some ways that you work with communities to improve health outcomes, and how does that work intersect with other efforts to improve a community's sustainability? So kind of a similar question, but yeah, just communities in general and those health outcomes.
Yeah, sure. So, one of the other exciting things that we do from our office is we help support the health department's healthy development coordinators. So throughout the state, we have our local health departments in the counties, but then we also have regional health offices that kind of oversee the different regions across the state. And so each of those regional offices has a position that was established about 5 years ago called a healthy development coordinator. And these are really cool positions. Their whole job is to be the bridge between sort of the built environment, like land use planning, parks, transportation, housing, and public health. Some of them have public health backgrounds, some of them are urban planners, but that's their whole job, is to make that connection and try to support healthy built environment development in local communities where they work. So we have these positions. They do all sorts of interesting things with communities. They help identify funding sources. They help communities write grants. They can help bring data. They can go to planning commission meetings or council meetings, or work with mayor's offices to help bring public health into the conversation and some of the decision making that happens around how communities develop. They can provide technical assistance in all sorts of ways. So they do a lot of great work. They're really the arm of our office on the ground. They're really the ones out there building relationships in local communities. And to my knowledge, there really aren't any other state health departments that have positions like that. So they're really unique and really progressive. And we decided to invest in positions like that because so many of these kinds of decisions that are made around healthy built environments are happening at the local level. A lot of those things don't happen at the state level. And so we really wanted people who lived in the communities where they worked, who were on the ground, who knew people, could build those relationships. One of the really cool things they're doing now, they've done 4 of them so far, and this is a tool that they can use moving forward. And if there are communities interested in this, feel free to reach out to me after. But they are now hosting what are called active living workshops. So these are workshops where you bring together community stakeholders to, there's sort of an educational component. So they spend a day or a half day sort of learning about that health and built environment connection. And then they actually go out and do a walkability assessment of a space in a community. Maybe it's downtown, maybe it's somewhere else. They actually go out and sort of identify like what what promotes walking and biking here? What is a deterrent to walking and biking, and how can we fix those problems that we see? And sort of bringing people together around that issue, and then trying to think about what are some next steps we can take, and how can we work on this to get the funding and the policies in place to improve walking and biking in our communities. So it's a really great tool for bringing communities together. Those healthy development coordinators are facilitating these processes across the state. So just a really nice tool and a nice way of engaging communities in this type of work.
And how would, so if any of our audience members wanted to engage one of their healthy development coordinators, is that something that's just listed on y'all's website that we can include in the follow-up?
Yeah, it's on our website. So we have all of our healthy development coordinators listed and the counties that they serve. You'll notice that the cities are not in there again, and that's why I mentioned the way that health departments are structured in Tennessee. The metro areas are not their priority because the metros have their own health departments. But there are instances where they can help support work in the cities. So if you're in a city like Nashville, there might still be an opportunity to work with your healthy development coordinator. And if you're in an outlying county that's not one of the 6 big metros, then they're absolutely there to help support you.
And I'm sure we do have folks on our call that are maybe not directly in Davidson County as well. So our next question, so across the country, low-income communities, communities of color, and other disadvantaged communities are the ones that tend to be most impacted by environmental and health hazards. So we're curious, how does this intersect with, impact, or influence the work that you do?
Yeah, absolutely. So I'll just say more broadly. In public health, we think a lot about addressing health disparities. So like a health disparity is when you have different groups that have different health outcomes. And typically those disparities are caused by systemic issues, so health equity issues. So if you have health inequities, that can produce health disparities. And so we're often thinking about, why is this group healthier than this group? And how do we close that gap? How do we help people who are less healthy get healthier? And so, that's really foundational to what we do in public health. And yes, absolutely. So when we're talking about climate change and a lot of other different health related issues, we really need to be thinking about where we target our resources and how we engage those communities in decision making. So, one of the things that we're doing right now to try to make sure that we're getting our resources to the right place, I'll go back to our Built Environment Grant Program. So, we've always required our grantees in their proposal to say, how are you engaging your community? Can you demonstrate community support for this project? How are you addressing a health disparity through this project? We're taking that a step further now. And so for our next round of grants that we award, we will only award projects that are in an area, in a census tract that is high vulnerability. So the CDC has a way of assessing vulnerability called the Social Vulnerability Index. And that's something that you can access for free online. And it goes down to the census tract level. So, that's, about the size of a neighborhood. And, so we're saying now that if you want to get grant funding from us to plan or build a project, it has to be in an area that's more vulnerable. And so that takes into account a lot of things like race, ethnicity, single car households, et cetera. It really was designed to understand which communities are most vulnerable to health hazards, to natural disasters, things like that, to know where to target resources. So we're trying to use that existing measure that the CDC has created to help guide where we fund some of our projects. The healthy development coordinators that I mentioned as well, they often do help write grants and help support projects in communities that are very small and have very few resources. So when we talk about inequities, a lot of small rural communities do not have staff who can go out and find funding for projects. And so they help them to identify funding and help write grants for those. And they do a lot of projects on the ground where they're engaging communities of color, low-income communities, people with disabilities, seniors, to try to improve their neighborhoods.
Amazing. And Christina has popped in a little follow-up question for us on that, since you kind of brought up how climate intersects with health. Just kind of wondering if you could elaborate a little bit on just how does climate exactly intersect with health and health outcomes?
Yeah, so when we talk about climate, so I'll use one example. So this is something that I've been thinking a lot about lately. And we've probably all been thinking a lot about it lately. So heat resilience and extreme heat. So, we had one of our, hottest summers on record recently. I think it's been top of mind for a lot of people. And so, these extreme heat events, there's a relationship between people who are older and people who are lower income being more vulnerable to extreme heat events and really natural disasters in general. But extreme heat actually is the most deadly weather phenomenon, which a lot of people don't realize. I didn't realize that until pretty recently. So we often think about making sure that we are protecting people against things like floods and tornadoes and hurricanes, which absolutely we need to be doing, but we often don't think of some other things like extreme heat. And so if you have a pre-existing condition, if you have a respiratory illness or heart disease, you're much more vulnerable to extreme heat. And so we know that when we do have these adverse weather events that are becoming more frequent and more severe, we know that they're going to impact more vulnerable populations far more severely. And so we need to think about that in public health in two ways. One, we have to think about how do you sort of mitigate the impacts. So how do you help people, for example, in an extreme heat event to get to a place where it's cool? Do you have a cooling center or a resilience hub or a place in your community where you can go to make sure that you don't end up in the ER or have a serious health consequence? And where do you put those? Where are they needed the most? And then we also have to think from a prevention perspective. What are the things that we're doing that are causing this to happen in the first place? So, are there things that we can do to reduce tailpipe emissions from vehicles? So, things like electrifying vehicles, things like improving public transportation access and giving people opportunities to walk and bike. Which reduces overall temperature and has a whole myriad of health co-benefits. How do we address some of those things through prevention? So we need to help people as things are happening now, but we also need to be thinking about different ways of creating and building our communities so that they don't happen in the first place.
Just remembering many episodes that we've had in the past that kind of touch on some of these topics and some of the ways that we're doing that here in Nashville, but I definitely see some need for follow-up with maybe our own Metro Health Department if we can get one of those folks in to talk a little bit more directly about that. Now, you talked a little bit about prioritization already, but are there key issues that your office prioritizes based on overall improvement to human health? Or to say it in another way, are there some key stressors that have a greater negative impacts to human health that should be focused on by a community, including individuals, myself as in my partners as government or private industry, to improve the health of our residents?
Yeah, so that's one of our big challenges in public health, is to figure out where to target limited resources. And I think everybody deals with that in government. We're pretty used to having to prioritize, no matter what level of government you're in. But yeah, it's an exciting but daunting task to think about all the different ways that we could try to partner with others and get involved and what issues to work on. In our office, we have often focused a lot on trying to increase physical activity. We've seen that as a priority because if you can increase physical activity, that has a whole variety of different benefits. So it benefits the individual I think it's pretty obvious to everyone why physical activity is good. But if you're trying to find ways to promote physical activity, you can't really just say people need to go out and exercise more. Oftentimes, people don't really have the opportunities to do that. So we're thinking a lot about increasing access to parks and greenways. Parks and greenways are a great resource for physical, social, and mental health. They're places where people can gather. They're places that cool the temperature and give you an opportunity just to be outside and active. We know that if you're active outside, as opposed to just being active inside, that you have a whole other level of benefits just to doing that activity outside. So that's one thing we're thinking about. Another is, I've mentioned this already, active transportation. There's so many negative health consequences to commuting in your car alone for a long time. And there's a lot of research that shows how this is bad for people's mental health. It's bad for people's physical health and their weight. And then, of course, it's terrible for the environment, which in turn exacerbates many other health conditions. So if you're trying to, encourage people to not have to drive alone in a car and commute alone in a car, we're trying to think about what are the other ways that you can get around and how do we promote active transportation. So, so that's a big one. And obviously public transportation is considered active as well, because you're pretty much always walking to and from a transit stop. So you get a little bit of physical activity benefit that way as well. So I think those are some of the things that we're really focusing on. Definitely healthy eating is a big one too. Thinking about access to healthy foods is really important. Sometimes that's, farmers markets, sometimes it's grocery stores, but there are all sorts of ways of addressing that. And then, one of the other things that we've been thinking more about lately that we really not traditionally been involved in as much in our department is thinking about housing. So, housing is so foundational to everyone's health and well-being. And so it's really difficult for us to not be involved in some way in housing. Now, this is sort of like what I was saying before, we don't directly control housing decision-making. We don't have funds for housing, but there are some things that we can do to help support safe, stable, and affordable housing. So, so we're in the process now of working with some partners at our state housing agency, THDA, and some others to try to connect the healthcare and housing sectors. So this is something that's happening in a lot of states, and it's happening a little bit here in Tennessee now, but hospitals and health systems are also recognizing now that it makes sense to invest in affordable housing and housing retrofits and aging in place and improving indoor air quality in people's homes, all of these things. Because if you have someone come into a hospital and then you discharge them to a house that has mold or poor indoor air quality or no home at all, there's no way that person's going to be healthy. They're going to keep coming back with the same health issues, and there's nothing you can do in the clinical setting to help with that. And so, we're trying really hard to help build some of those relationships and partnerships so that, we can find ways to get healthcare investing more in housing as a preventive effort.
I've noticed that a couple folks have been popping some questions in the chat. So just going to remind everyone, if you want your questions, we are going to get to those here in just a few minutes, but make sure you're popping those in the Q&A if you want to get those answered. Now, John, you've talked a lot. You've mentioned this built environment a couple of times, and your office clearly does a lot of work in the built environment space. So could you talk a little bit, kind of elaborate more about the connection between our built environment? You touched on it quite a bit, but anything to elaborate more on our built-in environment and health, as well as what does it mean to have healthy development?
Yeah, so yeah, I've touched quite a bit on that, and I think, maybe what I'll add is that we in our office are the home for a lot of the built environment work that happens at the Department of Health. I've mentioned our healthy development coordinator position, so they're really doing a lot of work at the local level. We have our grant program where we can fund planning and construction. Those projects all have to be publicly accessible and health promoting. So, you can't build something and charge a fee. They have to be available to anyone in the community. And we've also created a number of resources that we have available on our website. We have a resource for active building guidelines. We have a resource for the connection between health and the built environment that's really aimed more at kind of local officials and policymakers to help them understand that connection as well. And a number of others too. We've also created about 60 case studies that are available on our website in Tennessee of examples of healthy development. Most of those are in suburban and rural areas because we kept hearing, yeah, that's great that they're doing that in Chicago or San Francisco, but we're Tennessee, and not just that, we're rural Tennessee. Those things aren't going to work here. And so, we wanted to show examples that were success stories across the state where people could see what this looks like in practice. Because I think, sometimes it's tough when you have research that shows that there's a relationship, but then, how do you take that and do something with it? How do you operationalize this idea? And so, we've worked really hard to kind of be trailblazers, I think, in that space as a health department to figure out what our role is. So, yeah, so I think it really goes back to, when you talk about the health and built environment connection, it goes back to a lot of the things that people put in the chat when we very first started this conversation and the things we've talked about. It's housing, it's walkability, it's bikeability, mobility, it's parks and green space. It's all of those things. So a healthy built environment is a place where people feel connected to one another, where they have a voice in decision making. So there's that social and civic aspect to it. But then the end result is a place where everyone is included and feels welcome and feels that they can thrive.
I have a small follow-up because I'm just curious, since you mentioned like really big cities like Chicago versus rural Tennessee, are there differences that you see, like significant differences in maybe focus areas for that healthy development or that connection for the built environment between those two? Or are they pretty similar in terms of focus areas?
Yeah, so I think, again, going back to this idea that there are certain things that are sort of foundational for health and thriving, I think those elements are the same no matter where you are. And I think sometimes when we talk about urban and rural, we tend to we tend to think of those things as these very fixed, specific types of places, and they're really actually pretty diverse. So, rural Tennessee, there's a lot of difference between different communities in rural Tennessee. They all look different. They may have different needs. And so, we try not to lump them all together, but we try to look at individual communities. And a lot of rural communities have these great old downtowns, and they have a really great walking infrastructure. And so they have something really great to start with and build off of. Some of them are thriving now and seeing a lot of new investment, and some of them are struggling. And so we do see a lot of rural communities where, one of the biggest issues is they just don't have as many resources as the city. They may be seeing some population decline, or they may not have as many resources available to them to build the infrastructure. So what we try to do is sort of get them connected with all the things that the state can provide. One of the reasons we fund plans, as I was talking about earlier, is that if a community doesn't have a plan in place, they can't apply for the funding to build it. So if you want to build a complete street in your community where you have different modes of transit that are available, you've got to have the plan done in order to apply for the funding to build it. Same with greenways. So, so we can fund the plans and don't require a match from them. And then they can then in turn use that plan to apply for the larger funding. But yeah, I think, people generally want the same things. And so I think in the cities and the rural areas, it maybe isn't as different as you would think, but I do see a lot of creativity in rural areas about people thinking about, okay, what do we have that we can build off of? And so it's sort of that asset-based approach. And a lot of rural communities have remarkably beautiful environments. They're in areas that have incredible, parks and just beautiful scenery. And so a lot of them are thinking about outdoor recreation and parks and green space. So I think that's a big one because they see that as something that benefits them, but also brings tourism dollars to their communities as well. So I think that's a big one that we see a lot about is sort of outdoor rec and parks and green space.
I think everybody on this call can think of places that they're going outside of Davidson County to do all of those things that you just said. It's reminding me I need to maybe plan another cabin trip or something at one of our wonderful state parks here in Tennessee. All right, I've got just a couple more questions and then we'll get to everyone's questions in the Q&A. So I had perusing your website. I don't think we've chatted about this, but please correct me if I'm just out of my mind. But what is the Tennessee Livability Collaborative? And what does it do? I had seen that on your website and I'm just curious, is that something Nashville or even some of our surrounding counties, something that we should be or could be involved in?
Yeah, no, I'm glad you asked about it. So the Tennessee Livability Collaborative is a group that was established about 6 years ago. This is a voluntary working group of state agencies, departments, and commissions. We started with 4 and we're now up to, I believe, 21 members. We do have a couple of academic partners as well. So our aim as a group is to align the work that we do and find opportunities to collaborate. So no one is required to be a part of this group, but we've been going strong now for a while because there are a lot of people in state government who understand that in the end, a lot of what we're trying to do is the same thing. You know, we have maybe traditionally worked a little bit in silos and, you know, and there are various reasons why that happens, but we were increasingly breaking down those silos and those barriers and building cross-agency relationships. So the idea behind this group is that we are better aware of the work that one another are doing. And that awareness can help us to think about ways that we can align our work and complement one another's work and support one another's work, and then find opportunities to collaborate with one another. So a lot of what we do, we meet every other month. A lot of what we do is talk about different initiatives that we have going on, a new plan. So at our last meeting, we had a presentation from the health department about our new state health plan, which touches on a lot of things that we've talked about in this conversation around, you know, emergency preparedness and transportation and housing and parks and green space and all those things. But we talk about things that are happening in our respective agencies. We can get feedback from one another. And then sometimes we even create new initiatives as a group. So it's exciting. We're facilitated by the health department, but you'll notice that health is not in the name. That's because we've worked really hard to make this kind of a neutral space. This is not a place where people come to do things for the Department of Health. It's a place where we can all come together to collaborate and build those relationships. And I couldn't tell you how many times I have reached out to someone that I knew through the collaborative when I'm looking for a contact at another agency. It's so great to have those people that you have those great relationships with, where if you're looking for someone in the Department of Education, I know I have, you know, my colleague from the collaborative at the Department of Ed, and I can reach out to her if I need anything from the Department of Ed. And so just opening up state government a little bit. So it's a great group. It functions, I would say, as what we call a health in all policies initiative. So health in all policies is this approach in public health where we recognize that all policy is health policy. So, you know, every decision that's made, every policy that's made is impacting health in some way, whether it's positive or it's negative or some of both. And so we want to make sure that even though we're not controlling, you know, decision-making in transportation or in housing or some of these other spaces or education, that we want to make sure that, you know, health is at the table and that we can help emphasize that health connection and help everyone better understand that. So it functions as a health and all policies group, but we are exclusively just a state group. So, you know, there are groups like this that exist at the state and local level across the country. Nashville also has one. So Metro Public Health in Nashville has a health and all policies group. And that group includes membership from a lot of different Metro departments. My understanding is that they are going to expand just beyond having metro government partners, and they'd like to include more nonprofits and academia and private sector as part of that group. So there's definitely an opportunity in Nashville to do something similar with that group that's part of Metro Health.
Shocked. I feel like I probably knew this, but it has left my brain, but maybe this is just brand new to me. Definitely will be looking into that. I'm sure my colleagues are involved in it. I'm going to combine our last two questions for you so we can get to Q&A, since I am noticing the time. You've already mentioned actually quite a robust number of resources that y'all have, but are there any other resources that you want to touch on that your office provides around improving health and sustainability? And then also, is there any way on the opposite side that our audience can support the work that you all do, or is there anything they should be getting involved in?
Yeah, so the one big resource I didn't mention is we have a Built Environment and Health newsletter, which is a great resource, and it's a resource full of resources. So it comes out every other week, and we have articles in there. We pull from a lot of different places. So it's things happening at the national level, at the state level, at the local level. But we share new resources that are coming out related to health in the built environment, things like reports or research studies, or just, great stories about initiatives that are happening either in Tennessee or elsewhere. We also have a whole section of that newsletter where we talk about different funding opportunities. And those are funding opportunities could be from us, it could be from other state agencies. Some of them are foundations, national and local foundations, or federal government grants. So we have funding opportunities in there. And then we've actually also created a website for built environment and health funding opportunities. That's a comprehensive list of all those opportunities. And then we have the ones that are coming up at the top of that page. So that's on our website. So you can sign up for the newsletter on our website. You can just Google Office of Primary Prevention, or you can go to tn.gov/built environment, and you can find our resources. You can find info about our grants and a map of all the grants that we've funded. You can find our Healthy Development Coordinator contact info. And then you can also find that funding opportunities page, which is a really great resource.
In that time, I signed up for the newsletter, and I popped the newsletter page into the chat so everyone can click on that. But of course, Christina, I have seen, has been collecting all of our wonderful resources that we will send you in the follow-up. This has been so informative, and I'm going to turn it over to Christina to jump into our audience Q&A.
Great. Wonderful. And I know John is outside of a conference or something. So if you hear anything, I just heard maybe an announcement. So no worries. That was honestly, I was mesmerized that entire time. I really, really enjoyed that, John, and appreciate it. And we don't have that many questions right now. I think everyone was just really absorbing the wonderful way that you also communicate. So just giving some folks some time, if you want to throw in one or two questions into our Q&A, that would be really wonderful. So I'll just give you guys a second, because we just have 3 questions right now. They're great questions. I just wanted to just say again how stark the kind of intersection is of health and sustainability. It's like you just gave a sustainability 101 crash course, and you were talking about public health. And I just think that is really one of the most beautiful parts of this episode, and what we talk about on this show is just all those co-benefits. And so just wanted to thank you and give folks some time if they wanted to put in any questions. So we only have questions from Denise's right now, which is funny. So the first Denise asked us, can the Healthy Built Environment Grant help with building the park in Madison on Madison Station Boulevard? And I know you were talking about how it doesn't maybe always go towards Nashville, but I believe in Madison. I believe this is up for approval in the mayor's spending bill, but can we use that for public park space if the mayor funding doesn't come through? So just a very specific question about how that grant could potentially be used for that Madison Station Boulevard.
Yeah, so a park would definitely be eligible. I will say though that our grants are fairly small. We have pretty limited funding. I would say it averages a little under $1 million each time we have a call for proposals. So this one that's coming up, actually next month, it will be released. It's about 900,000. So, we really try to make sure that we can fund a number of projects because we're looking statewide. So if you're building something with it, the maximum is 85,000, which isn't going to get you a very big park, but you could use it to partially fund a project. So we've had a lot of grants like that where our grant will be used to supplement larger funding. You can also use our grant as a match for larger funding. So if you had a grant from an entity to build a park, you could use our grant as the match, or you could enhance that with ours. So like our grant could be used to do something like putting in, lighting and benches and playgrounds within a park. But so the answer is yes, but it might not be enough to fully fund a park. I will say though, a really nice funding source for parks, and I don't know when their next call for proposals will come out, is Blue Cross Blue Shield. So you probably don't think of Blue Cross Blue Shield when you think about building parks, but they're actually putting quite a bit of money into building parks in communities in Tennessee, and they recognize that having green spaces in communities promotes health, and they want people in the communities that they serve to be healthier. So there's some sort of non-traditional funding sources out there as well that are helpful to explore. I'll reference our funding opportunities page again because it's a great resource for some of those places that you might not have thought of. So I guess the answer is yes, but other options as well that are out there.
Wonderful. Thank you again. Just all these great resources for folks to dig into, and they will all be in our follow-up email, as always, folks. So don't worry if you've missed any. So we have our other Denise is asking two wonderful questions here. So the first one she asked is, you spoke a lot about public transportation and bike lanes. Are you familiar with the idea of the 15-minute city? And she says it's where folks can meet their needs, food, school, work, etc., within a 15-minute walk or bike ride. So I guess Denise is just asking if you kind of work towards that at all, or if you're familiar with that concept and maybe can give us a little bit more insight.
Yeah, I am familiar with that concept, and I would say that aligns really well with what we're trying to do. So when we think about a healthy community, we're often thinking about sort of holistically. And so when you talk about a 15-minute city, I mean, transportation is a big part of that, but then land use planning is too. So in order to be able to get everywhere that you want to go in 15 minutes, you have to have policies that allow for more density in your built environment and mixed use. So, if you want to be able to get to things by walking and biking in 15 minutes, you definitely need those sidewalks and bikeways and maybe transit. But then you also really need all the other spaces that are connected to your transportation infrastructure to promote that as well. So if you have bike lanes and you have sidewalks, but then you have a sea of parking between that and the building, that's going to make it really tough. And if it's not mixed use, and by mixed use, I mean that you can have a single development that has multiple uses. So like a lot of the things you see being built in Nashville, where you have, maybe some restaurants and retail on the bottom floor, and then you'll have apartments or offices above. That's mixed use. That's a mixed use development. And so that's a great way to be able to have people who are living and working in a place where they can also do all the other things that they need to do to have access to those things. So, that's also really critical. And yeah, so I would say 15-minute city aligns with what we're doing, because we're working a lot in rural and suburban areas. That can be challenging, but again, there's a lot of variation and diversity even within those communities. So you really have to find those nodes and those opportunities where you can make that happen and then build off of those.
Fantastic. Thank you so much. So we are coming up on 1 p.m. And we usually hang on until 1:15 or when our questions are done. So we're just going to say thank you to everyone who has to hop off at 1, and we have a few more questions to get to. So we have two questions that are around healthy eating. So Ed is asking if your grants that we were talking about before can be used for community gardens, kind of to promote healthy eating. So that's kind of the first question. And then Denise is asking more of a broad question of, you can't talk about health without talking about food. What is your role in educating Nashville on the health benefits of organic or regeneratively grown food? And are you educating healthcare providers on food prescriptions? Can we use the grants for it? And then just kind of generally some more food information about your work.
Yeah, that's really good. And I'm glad you brought up food. And I've talked less about food because I'll be honest, we're doing less in that space, but that is also something that's on our radar. I feel like working on food security and healthy foods is something that we've been involved in a little bit, but probably not enough. So that's something that we are looking at building our work in. But yes, you're absolutely right. You cannot talk about health without talking about healthy eating and access to healthy foods. We're not really doing much in Nashville around that. So I would imagine that the Metro Health Department is probably doing a lot in that space around education, around healthy eating. But we have funded some things through our grant program, and then we've had some work happen through our healthy development coordinators at the local level around food security. So yes, you could apply for our grant to build community gardens. Absolutely. I think we've actually funded some community gardens through our grants before. We've also funded farmers markets pavilions. So in small communities, if you can build a structure for the farmers markets, that helps them get established. We actually funded a program where in Northeast Tennessee, I think it was called Pharmacy Fit, where people would come and they would actually walk at the farmer's market. And if they walked a certain distance, then they would get a discount on the food at the farmer's market. So just kind of promoting healthy eating and active living both at the same time. But we're working right now. We have a good relationship with UT Extension, and UT Extension is a really great partner in the food space. A lot of our local county health departments they all have prevention staff, health promotion staff, and they often work in partnership with UT Extension at the local level because they have a lot of programming around community gardens, canning of foods, around just cooking, a lot of different sort of educational programs and opportunities in communities. And so health department staff often partner with them on those initiatives. But yeah, so something that's really important, something that we're starting to think more about, sort of like housing. It's something that we recognized there was an opportunity to do more. There's no Department of Food at the state level, but I think that role can naturally fall to the health department. And so we're exploring what that could look like and working with UT Institute for Agriculture and Extension on partnering on that.
Fantastic. So thank you, Denise, and Ed for bringing up those food questions. So that was wonderful to hear, and just really appreciate how flexible it seems like your office is being with kind of seeing needs and going towards those and not just kind of staying with what you've done historically. That's great. So this might be our last question, but Ed is asking, kind of going back to that idea of density. So many neighborhoods are kind of oppose increased density. How have you been able to convince, or have you been able to convince neighborhoods to accept more homes, more people, traffic? And what benefits do you think that neighborhoods want in exchange for increased density?
Yeah, that's a really hot topic. Definitely in Nashville with all the development you're seeing. And that's, I would say, the opposition that comes up the most. And I'm really more speaking as a citizen of Nashville right now, as opposed to a health department employee, just what I see, in my neighborhood in East Nashville and just in the city in general, watching it develop. I think most often people are concerned about traffic. And that's tough, because if we're going to grow, traffic's going to grow. And if we don't have other ways to get around other than driving, we really need to be investing in better public transit and better infrastructure for walking and biking, so that at least we have different options. And I love the quote that you're not in traffic, you are traffic. And so people driving like to complain about other people driving. And, you know, we've built our communities to make that the easiest option. So we just need to think about how to not oppose new density and development, but invest in ways so that that doesn't impact us in a negative way, so that we're seeing a net benefit from that. In the smaller communities, it can be a really tough sell in some rural and suburban areas. Higher density, people just equate that with urban, quote unquote, you know, as people define that. And so it can be a tough sell, but the argument that seems to resonate with the most communities and officials in those communities is sort of the economic development benefits. And, you know, you see tax benefits from that and better utilizing your land. You know, if you have higher density, you're getting more benefit from that land per square foot financially for your community than you would if you were just doing like typical suburban development. So it requires new thinking, but there are small communities that are doing it really well. And so we try to hold those up as examples. But I think the economic development benefits seem to resonate the most. But the nice thing about a lot of this work, and you know, and hopefully if you take away nothing else from this talk, you take this away, which is that these things are all interconnected. So, you know, if you're changing your land use patterns and increasing density and walkability and bikeability and access to parks and green space, you're also seeing all sorts of other co-benefits. You're seeing economic benefits, you're seeing mental health benefits, you're seeing environmental benefits, you're seeing physical benefits from, you know, people being more active. I mean, so, you know, if there are certain things that if we're doing them, we're going to see benefits in a lot of different ways. And sometimes highlighting one of those particular benefits is what will get someone on board, and then highlighting another benefit will get someone else on board. But I think the interconnectedness of it all is really, you know, the overall message.
Beautiful. Wow, you did it. You wrapped it all up in a beautiful way with that last question. That was a great way to end this. Thank you so much, John. This has been, as I said, it was mesmerizing to me. You clearly know your stuff and are very passionate about it, and that came through. So we thank you for talking to our audience. We thank our audience for sticking around and hearing John give us all these great tips and resources. Keep an eye out for the follow-up email that will come probably tomorrow, and we'll make sure we get all of those things to you. And also just reminding you to please email us at zerowaste@nashville.gov your questions that you have for our questions or stories that you have for our December episode. And so we are excited to get those in. And unless Jen has anything else that she wants to say, I think we are ready to go to end this episode and thank John one more time for his time and his expertise.
Yeah, thanks everyone. Appreciate y'all being here, and see you all in December.
Yes. Bye now.
Bye. Thanks, everyone.